I think it's fantastic that today, the 70th birthday of the NHS, we're able to think about what it is about the NHS that makes us so proud and so pleased to have that as a system. I remember 2012 and the opening ceremony of the 2012 Olympics in London, and that bit where the NHS is celebrated, I think everybody felt was a really good symbol of us as a country, because actually the NHS is really part of what it means to be British. It's about solidarity, it's about a model that provides for people when they need it most and removes the worry from people that exists where you're actually having to fund your treatment, your health treatment in a different way. I think it's one of the things that all the research suggests makes people most proud to be British. It's an enormous honour to receive my honorary doctorate today, and it's special particularly because I'm receiving it alongside people getting their degrees and their qualifications who've been focusing on health service management and other aspects and professions that will help to contribute to the health service in the future. We really need you. The NHS doesn't work unless it's managed and organised as well as it possibly can be. It's an enormous undertaking to make sure our patients are getting the best possible treatment, and I hope you'll be part of it for many years to come. In celebrating 70 years of the NHS, we mustn't see it as being set in aspect. We've got to think about how we change it for the future. I want to see an NHS that actually more treats patients as partners in their care where they're able to do that. And I think we've got ways of using technology. Over at the QE hospital, for example, increasingly people are able to take control of their own records, to contribute information about their healthcare as partners with our clinicians, not just sort of receiving a service from the NHS. And thinking about how we shift power and make patients and citizens really part of what we're delivering in the NHS, I think will help us to build the NHS for the next 70 years, not just help us to celebrate what's already happened. One of the special things about working at the Queen Elizabeth Hospital as part of this campus is the partnership that we have with the University of Birmingham, and particularly through Birmingham Health Partners, which is a partnership between the NHS Trust and the university. We've been able to think about how we can bring together the very best science, the very best research and social science with really brilliant clinicians that we have at the Trust. And in doing that, we've built some really interesting research programmes. We're developing the methods that will enable us in the future to be more effective, more efficient, to do a better deal for our patients. And we can only do that because of that unique partnership, and it's really important, and we're in a very special position here in Birmingham, having this close relationship and having all these institutions physically close together as well as working hard for patients and the future of healthcare.